Hello everybody, this is Dr. Chimisi. Welcome to the Ghanaian Doctor. Today we are going to discuss shingles or Varicella zoster infection, which is quite common in the world. It initially manifests as chickenpox, which I'm sure we've all heard about. So usually when you have chickenpox as a child or as an adult, what happens is that the virus goes to hide in the nerves at your back after the chickenpox goes. And the virus can hide there for decades, sometimes 20 years, 30 years, without causing any problems whatsoever. Now, during times of severe stress or during times of severe infection or anything that will bring your immune system down, this virus can become active again, can move away from its hiding place in the nerves at your back and cause a rash. In some people, especially when the immune system is very, very low, like maybe you've had a transplant and you've had to be given medications to reduce your immune system, or you have severe disease causing immune suppression like HIV/AIDS, or kidney disease, severe kidney disease causing immunosuppression. Sometimes the varicella zoster infection can cause multiple rashes to appear on your body, more than 2 different sites. It can even get so bad as spreading to affect your brain, your lungs, your spine, your liver, your stomach, or other places. When it affects your eyes, okay, it's called herpes zoster ophthalmicus. It's an emergency and you have to quickly respond and report to the hospital so they're giving IV medications. Sometimes it can affect the ear as well, and that is called Ramsay-Hunt syndrome. Also has to be managed as soon as possible. All right, let's go into how it presents. Usually, in most cases of varicella zoster, the only thing that presents is the rash, and we don't need to do any laboratory investigations for it. It's a clinical diagnosis. So, what do we do when we see that you have varicella zoster infection? There are 2 main ways of management. Number 1, we give you oral antiviral medications. There are several oral antiviral medications available, but the most important thing is that it must be started in the first 72 hours after the rash appeared. If it started after 3 days, after the rash has appeared, it's less effective. And then the second thing too is that if you don't give the antiviral medications, there's higher risk of complications associated with the varicella zoster infection. This complication, which is very, very disturbing, is post-herpetic neuralgia, where you have severe pain around the area of the rash, which can persist for months or sometimes even years. So taking antiviral medications helps reduce the probability of getting this post-herpetic neuralgia. Again, taking antiviral medication will shorten the course of the infection. All right, so for some people, especially people with compromised immune system, they may have to go on admission and receive IV antiviral medications. And this is sometimes given over days or sometimes up to 2 weeks, depending on how severe the infection is, just to make sure that it is well controlled. Varicella zoster infection is very infectious, and it's not as infectious as chickenpox. Let's say it's about 33% as infectious as chickenpox. However, it's still quite infectious. So if you have shingles and the rash hasn't yet crusted over, doesn't yet dried, it's advisable not to go close to pregnant women or young children or elderly people or people with immunocompromised states. Otherwise, you may infect them with an infection and it may end up giving them a very uncomfortable experience. So that's just something that I hope we can all learn from. Eating a lot of fruits, eating a balanced diet, and getting enough rest has been seen to actually help to improve the symptoms of varicella zoster infection. However, it's very important to get antiviral medications to shorten the duration of the condition and also to reduce the risk of post-herpetic neuralgia. In managing pain, which comes with shingles, most of the time, diclofenac, paracetamol, the NSAIDs are not enough to control the pain. So sometimes we have to use nerve numbing agents, which are specifically for reducing pain in nerves. Sometimes they're given singly or double, together, depending on how severe the pain is. So if the pain is very severe, of course, the doctor will prescribe and recommend you take some, acetaminophen, paracetamol, or some diclofenac NSAIDs. But if it's not enough, you recommend that you take nerve numbing agents, which are readily available and can be substituted for the NSAIDs or acetaminophen. In certain countries like the UK and the USA, there are vaccination programs available for Varicella Zoster infection. But in places like Ghana, you may have to rely on being quick to notice it when a rash comes and trying to eat well, stay healthy, drink a lot of fluids, and get enough rest. Finally, I'll leave you with this myth I heard a couple of days ago that if Varicella Zoster infection, encircles you, then you're going to die. Like if the rash goes beyond affecting just one aspect of your body, and it goes all the way around, you're going to die. This myth has some truth to it, because before Varicella Zoster infection can encircle you, it will mean that your immune system is quite compromised, and it may be a sign that you probably have a condition causing a very reduced immune system. It could be a severe infection like HIV/AIDS, could be kidney disease, very severe end-stage kidney disease, could be having a cancer which is poorly controlled. So, to an extent, if such a thing is noticed where the rash goes all around your body or all around someone's body, it's actually a red flag that must be addressed, investigated as quickly as possible, the cause found and treated. So, I hope I've clarified that myth as well. I hope you enjoyed this discussion on varicella zoster infection or shingles. Take care. See you at the next one.